In this video, what you can do to release your iliacus, which may be the cause of your unresolved knee pain coming up. Iliacus can have a significant effect on the health of your knees and whether or not your knees are functioning properly and without pain, because the iliacus muscle is one of the main hip flexor muscles, and those are the muscles that draw your knees towards your chest, get that thigh closer to the torso. Iliacus works with its best friend, the psoas, to curl you up in a ball, and it responds directly to stressful situations. The thing about iliacus is that it has a strong pull of tilting the pelvis. It has a much stronger pull and effect on the pelvis than it does on the back, where the psoas has a really strong pull. Now, the iliacus can get the pelvis kind of locked in a tilt, or it can be resisting too much tuck in your pelvis, and that's going to have a big effect on the quads and on the hamstrings. So all of these muscles are kind of at play with the movement of your pelvis tilting forward and tilting back. So when the iliacus is loaded with tension, it might lock one or both sides of your pelvis in a tilt. It might lock your pelvis forward, which is going to shorten the quads, and it's going to pull on the hamstrings because the hamstrings tuck the pelvis. Now, the quads and hamstrings relationship is the most important relationship that directly affects knee pain. The quads tend to refer directly in the knee. So if you're having trouble walking up and down stairs, walking up and down hills, feeling like your knee is going to give out, you definitely are going to need to treat the hamstrings and the quadriceps. But if you're doing that and it's still coming back, that pain is still coming back, looking further up that functional line, we find the iliacus. And I have seen the iliacus cause unresolved knee pain in many of my clients and students. So I wanted to give you this information here and then show you a simple way that you can release your iliacus to take the tension out of the hamstrings and the quads and allow your knee to function properly. So clarity, right? The iliacus muscle draws the pelvis forward in a tilt, and it kind of locks the pelvis down toward the thighs, right? Hip flexion. But it's a particular kind of hip flexion. It really has a strong pull on that pelvis. So when this muscle gets locked, it affects quads and hamstrings, and that affects the knee. So you can very easily and simply release tension in your iliacus and then see if that allows the pelvis to move more easily so that the knee can be restored to pain-free function. So let's release that iliacus. The iliacus, you can see here in the picture, lines the inside of your pelvis. And then it attaches down on the femur a little bit toward the back. So it has that strong pull on the femur, it attaches with the psoas at the femur, and is in this dynamic dance of the pelvis and the thigh in relationship to each other. So to find your iliacus trigger points, the main trigger point lives right near where the very top of your pelvis is. So you're going to, and I'm just going to show you here, I can find the top of my pelvis is right here. I kind of slide my hand into the side of the waist, and then I'm going to take my thumbs and I'm going to lean a little bit toward that side. That's going to soften all of that tissue so that I can get my thumbs in there and release my iliacus. And I'm going to get over that edge, over that lip of the pelvis, sink down toward the floor a little bit, and then push my thumbs outward into the very side of the pelvis. And then you can walk a little bit forward toward the front of your pelvis, or you could walk a little bit back and explore that area, see if you have a tender spot. Well, I sure do have a tender spot right there. So I'm sinking in, I'm kind of rounding toward that to make that tissue softer. And then I'm going to bring some movement in. I'm going to tilt and tuck the pelvis a little bit, and that's actually going to retrain the muscle and the nervous system to kind of let go of this trigger point, to let go of this tension. So I keep breathing, rocking the pelvis forward and back. Mine's letting go already. Maybe take another breath. Yeah, so much better. So much better. So now, if you've been having knee pain, I'd like you to get up and do a couple of squats, just kind of seeing if that had an effect on the freedom of your knee. See, if that pelvis is locked forward, it's going to keep pulling that femur toward the thigh, which is going to make the quads and hamstrings just really not be able to do their job well and smoothly. So now that you've freed the pelvis from being locked down toward that thigh, quads and hamstrings should function a lot better. So give it a try. Get up, do a few squats, see if that helped, and then drop us a comment below and let us know how you feel. I'm Cat Matlock for FreeBody. Thanks for watching.